Welcome back. The risk of spreading coronavirus has pushed many local businesses in the region to close or to alter operations. This means that workers from all across the region are without work or facing reduced income, leaving many to wonder how they will afford basic necessities. For a subsection of local residents, this has fundamentally disrupted their entire lives. Maryland, Virginia, and the district have banned evictions for tenants who can't afford to pay rent. They've mandated that utilities like gas, electric, water, and even internet connection remain intact for the foreseeable future, but this might not be enough. Meanwhile, people with disabilities are trying to navigate the public health crisis without access to resources that are in high demand, including food delivery services and transportation. Joining us now is Ryan Honig, a disability advocate and public speaker. Ryan Honig, thank you very much for joining us.
Thank you for having me on.
You have said that elements of life during a pandemic are not new for you. What do you mean by that?
What I mean by that is there are a lot of folks with disabilities who are frankly used to being isolated and used to leveraging a lot of the tools and systems that are being put into place right now are things that we have tried to leverage or utilize for a long time. An example of that I can immediately think of is a lot of folks with disabilities who need telework, and that has now become standard practice across a lot of different organizations and businesses, and it's something that again we have utilized to a great degree up to this point, to the extent that various companies have allowed their employees to do so. That's just one example, but
Hey, go ahead.
Go ahead.
No, you go ahead.
Yeah, the isolation part of this is something that I think a lot of folks with disabilities are watching this unfold and watching all these articles that are coming out and talking about ways to quote unquote stay sane during this. I mean, this is obviously a very challenging time, but it's not a new experience for a lot of people like myself who have to think about how are we going to get, you mentioned at the top of the segment here, food. Things like food delivery for various platforms. There's obviously the Grubhub and things like that, but more there's also in various cities there's like a Peapod or Instacart, those kinds of services, and those are some things that the disability community is frequently utilizing or trying to, and because of this pandemic, that's really increased wait times. And obviously we want people to stay healthy and self-isolate and be mindful of those things. But if you are healthy and you do need to venture out for essentials, do that if you can, because what you're doing by leveraging those other services is you're increasing wait times for people like myself who don't have the option to go out right now because we are immunocompromised or we do have other challenges.
Ryan Honig, we've all been instructed to take extra precautions and to self-isolate or self-quarantine and practice social distancing. Do you think the guidelines put out by experts take into consideration the needs of persons with disabilities?
I think that everybody's trying to follow the guidance the best that they can, and again, folks with disabilities are used to having to adapt as things come up. There was obviously a discussion earlier in your segment about telehealth. That's definitely something that I'm leveraging now with my healthcare providers, and that's been helpful. This has also brought up the idea a lot across, you mentioned folks that aren't sure what this pandemic is going to mean for them academically, whether or not they're going to graduate or what that means for how they're going to complete their work online. Obviously, that applies to a large swath of folks, but this makes me think a lot about when I was back in school, and a lot of professors have policies in their attendance that would say if you miss more than X number of classes, that's going to count against your grade. And of course, now with a lot of universities and courses moving to online, those policies are falling away, and that's something that a lot of folks with disabilities have been trying to say for a long time that has needed to happen.
Also joining us is Radha Muthaya, President and CEO of the Capital Area Food Bank. Radha Muthaya, thank you for joining us.
Thanks, Kojo.
Before we talk about what Capital Area Food Bank is doing to respond to the pandemic, give us a little context. How many meals do you normally serve?
Sure. Under normal circumstances, we provide food for about 400,000 food insecure across the district, suburban Maryland, and Northern Virginia. And that translates to about 32 million meals a year in normal circumstances.
Rada, what changes has your organization made due to the coronavirus? How are you responding to the pandemic?
Well, as you've been covering throughout your show, and we all know, this anxiety that we all feel is really a reality for many in our community who don't know where their next meal is going to come from. And for them, it's far worse right now. They are trying to determine the best ways to be able to get food, not only for their day-to-day needs, but also to be able to keep some food on hand for the next few days or few weeks, as we're being instructed to by our public health officials. So we are prepared. The Capital Area Food Bank has been preparing this for probably the last month now, thinking about different scenarios and what we need to do. And thanks to the community's support, we have the scale, the network, and the storage to be able to leverage in these types of emergency situations. So we're being nimble, and we're shifting how our operation is working at this point. Typically, we work through a network of about 450 regional partners and 300 direct distributions. But in this evolving situation, we're modifying our service model to be able to meet this need. So what we're doing is there are about 150 or so partners who've told us that they're able to continue operations, likely into the next week or potentially more. We're continuing to provide a lot of food through that partner network. We've also identified about 20 high-capacity, what we're calling partner hubs, that are able to that we're able to send much more food through, and they're able to provide that food to many more individuals who are in need. So that's part of what we're doing. Also, we typically provide after-school meals to about 11,000 children in the area. Usually, those are hot, meals that are temperature-controlled and provided within the confines of a school or Department of Recreation or some other kind of after-school service. We're switching now, and have switched rather, to provide cold to-go meals to ensure that children have that third meal of the day. And finally, given all of the social distancing guidelines that we too are practicing, if someone finds that they are not near one of our 150 partners or not near one of these 20 hubs, and then what we're doing is we're creating these pop-up pantries where we are boxing food, and we are basically having people come by. If they're driving, they open their trunk, we put the box in there, they drive off. And if people are walking up, we're marking kind of 4 to 6 feet apart to maintain adequate safety. And then we're providing people with a box of food that can provide a family of 4 with supplementary nutrition for 4 to 5 days.
Here now, with more information about what people can do, is Jen Yates in Washington, D.C. Jen, you're on the air. Go ahead, please.
Hi, thank you for having me on, Kojo.
Jen, what organization are you with?
I'm with an organization in Northern Virginia called Real Food for Kids. We work to provide increased access to healthy food for school kids throughout the year. And now in this time of incredible need, we're working and transitioning our efforts to providing healthy food to kids and their families right here today and every day as long as we can keep going.
Thank you very much for sharing that with us. Is there any more information you'd like to give out?
Yeah, so we're out here at Bayou Bakery. We partnered with Chef David Guas. He's been a partner of ours for many years, and he approached us and asked what he could do to help provide food for families in this time of need. So we're handing out hot plant-based meals to anyone who comes up and asks for one. We had a family come by earlier today who said both the mother and father had lost their jobs in the restaurant industry. They have kids, and they don't really know where their next meal is going to come from. So we're handing out food every day at Bayou Bakery from 11 a.m. to 1 p.m., Monday through Friday.
Thank you very much for sharing that with us. By the way, Ryan Honig, we got a tweet from Sue who said, to your point about persons with disabilities, particularly developmental disabilities, service providers are moving their interactions to online platforms such as Facebook and Zoom. Has that, I think you also mentioned earlier, Ryan Honig, that has been your experience also.
Yes, it has. And I think the takeaway from all this, I hope, is that these things that are put in place now as a result of going through this pandemic, that these things stay in place, that they remain a tool that can be leveraged, when all of this eventually does settle at some point. because they're proving to be effective. They're not things, we hope, that are going to be here for a short period, and then as soon as things, quote unquote, return to normal, that these systems are no longer accessible, because they're proving to be useful.
Radha Muthaya, during this difficult time for people, what communities need the most assistance?
We have, during these times, I'd say the need is across the board, and we serve, from very young children to working adults and families to seniors. Obviously, from what we've heard from public health officials, this virus seems to disproportionately affect seniors, and so we are certainly focusing across the board, but also in ensuring that our seniors are well protected, have sufficient food, and are able to take care of themselves during this point in time. I think the other thing that we have to highlight here, given that this is something that doesn't seem to discriminate, we're all feeling that sense of anxiety, and we all are, interested in ensuring that we have sufficient food, is that we're seeing that for those of us who can afford it, we're going to the grocery stores, we're getting the deliveries, and food is flying off the shelves. Now, what happens in those instances is that the typical donations that we get from retailers to be able to provide food to the low-income community is not coming through to us. In fact, we're seeing about a 50 to 75% reductions in food donations from retailers, in shelf-stable food donations. That means we don't have, to put it in perspective, about $2 million worth of food that we would typically have in donations to be able to provide to the low-income community. So an impact that we're seeing here in being able to provide food to across the age spectrum, if you will, within the low-income community is the need to be able to purchase many, many truckloads of food to be able to provide those who don't have the ability to go to the store and purchase it for themselves.
And because of the shopping demand in the retail industry right now, that obviously is having an effect on what you do.
Absolutely. I'll give you some perspective. For the last month, we would have typically had, many, many trucks of donated food, and we would have only had to supplement that by purchasing 2 to 3 additional truckloads of food. But in the same time period, we've already quadrupled our purchases, and we have purchased almost 8 to 9 additional truckloads of food, with many more that we're planning on purchasing just to keep up with the demand that we're seeing. So that is a substantial change in our operation in terms of the supply of food, and how we are having to purchase just 4 to 5 times more than we typically would have.
Ryan Honig, I'd like you to reiterate, has using food delivery services become a challenge for you due to the pandemic?
It has, because as I alluded to earlier, it's increased wait times. So when all of this first hit the region here, I actually put in the first cases, I think, came just before last weekend, and I put in a food delivery order on Thursday of that week. And usually, because of the way these systems typically operate under normal circumstances, it's a couple hours of delivery window. In this case, when I placed the order last Thursday, they said your next delivery is in about a week. It would have been from that Thursday. It was Wednesday, which was yesterday. So again, if you need to self-isolate and you are a vulnerable population, that's going to affect your ability to get food quickly.
We got a tweet from the DC Developmental Disability Council saying, we are worried about how this is affecting people with intellectual and developmental disabilities relying on supports through the Department of Disability Services. Direct support professionals are responsible for the health, safety, and happiness of many people now. Ryan Honig, do you use the services of the DC Developmental Disability Council?
I personally do not, but I can tell you, as we've talked about, that the services that I do leverage through my healthcare provider have moved to an online platform, and that has been tremendously helpful. And there are things that I hope continue to stay. One of the things that I think is also worth pointing out is the transportation part of this. Myself and others who rely on either public transit right now, which would be a very challenging thing to leverage, or who rely on rideshare because we don't have licenses. That does include myself. I was a big client or somebody who would leverage Lyft and Uber and other rideshare services. And I'm obviously trying not to leave my house, but in the event that I do need to, that's how that's going to happen, and that is also a risk, because it puts me in contact with folks who may be unknown carriers of this virus.
Radha Muthaya, before we go, if people need help or information about how to access your resources, what should they do?
There are a couple of ways that people can do it. One is we have a hunger lifeline, and I would encourage anyone who needs food support to call that. That's 202-644-9807. Second, if you go onto our website at capitalareafoodbank.org, we have an interactive map that is live on the site right now, and it will show you exactly where our partners are, their times of operation, where these hubs are that I've referred to. And through the media, we will highlight if there are pop-up pantries that are going to take place in areas that don't have sufficient partners to service the low-income population. So those are two different areas that I would suggest your listeners go to or just recommend to others. And I would also just say that the community has been incredibly generous in coming forward, both volunteers who we need desperately to be able to pack all of these boxes. We aim to have about 10,000 boxes packed next week and ready to go. And just rest assured that we are cleaning our facility, we are maintaining distance in the warehouse, but we do need the support of volunteers. And as I mentioned earlier, purchasing food is a significant way of life, it seems like, for us at this point, and that is resource intensive. So thank you to those who've generously contributed already, and we welcome further contributions, financial as well as volunteers, so that we can get through this time together as a community.
Radha Muthaya and Ryan Honig, thank you both for joining us. This segment on how people who were already struggling are coping with the coronavirus pandemic was produced by Richard Cunningham, and our conversation about how organizations during the pandemic are reaching out to those with mental health challenges was produced by Victoria Chamberlain. Coming up tomorrow on the Politics Hour, Senator Tim Kaine talks about paid sick leave and federal employees teleworking during the coronavirus outbreak. Plus, Maryland State Senate Majority Leader Nancy King reflects on what passed and what didn't during the shortened legislative session. That all starts tomorrow at noon on the Politics Hour. Until then, thank you for listening. I'm Kojo Nnamdi.
The Kojo Nnamdi Show is produced by Julie Deppenbrock, Sydney Grannon, Lauren Marco, Kurt Gardenier, and Victoria Chamberlain. Our managing producer is Mana Kashfi. Our engineer is Natalie Urivlivker. Our intern is Richard Cunningham. For past shows and more content, visit kojoshow.org.
Thanks for listening to The Kojo Nnamdi Show, and if you're already a member of WAMU 88.5, thank you for your support. If not, it's easy to give online at wamu.org. Just click the donate button, and thanks.